Welcome to Medical Minutes here on DMG TV2 and Time Warner Cable. We have a special episode for you this time around. We will end up here at the New Philadelphia offices of the American Red Cross with a detailed demonstration on CPR. For that, Dr. Jim Hubert's in our studio. He is the Tuscarawas County Health Commissioner. He has an update on the measles outbreak that is creeping toward Tuscarawas County. First, we start at Union Hospital, where the CEO, Bruce James, explains how they're doubling the size of their emergency department.
We just recently announced that we're about to embark on building a new emergency department. The emergency center will be developed out this direction to the north. It's going to approximately double the size that we have currently. We know that our volume has increased steadily over the last 25 years that we've been in this area, and it will continue to grow over the next 25 years that we will hope this building will service. It'll be 2 stories out there because you can see the drop of the land. We'll actually have to build 2 stories in order to keep it up to this level. We'll have a separate entrance, or separated entrance, I guess is a better way of saying it, of the walk-in business and the ambulance business. That will make it a little bit easier. We're building a lot of efficiencies and designs and the modern techniques that are used in emergency departments. It's always sort of surprising how the healthcare changes in a period of time, but we'll have specialty rooms for certain areas, and our hope is that we will diminish the wait times for people. We're going from approximately 25 to 27 care areas to 38 care areas in the new building. Right now we're estimating the cost to be about $17.7 million. That includes both stories, and that'll have a little bit of storage space under it. One of the things you get when you build out on here, you get a nice little basement to go with it. So part of that basement will have the workspace for the doctors and the staff, and another part of it will just be kind of storage area. And that's pretty contemporary with pricing in today's market for the size that we're building.
When will you start?
Hopefully in about 90 days we will have got our financing in order and our construction set. I'm guessing that sometime August, maybe early September, we'll put a big hole in the ground, and it'll take us about 15 months to build it.
The auxiliary made a pledge this year to the hospital that for the next, including this year, for 3 years, we'll be donating $100,000 toward the emergency reception area for the new area. We try and help the hospital out with whatever they need, and I know in the past they've done the nursery, we did the pharmacy a few years ago, and now this, so we're moving ahead.
We're very thankful that the auxiliary made this what we call the first lead gift for the capital campaign for the emergency center, and so we're very grateful for that. And right now, of course, Bruce said he would like me to raise $17.7 million. We're hoping to raise through area families, businesses, and foundations through their philanthropy. I would like to say a minimum of $5 million. Right now, we're in what somewhat the quiet phase of the campaign. Right now, we're talking to certain families and businesses about making lead gifts. And as we approach the groundbreaking, the campaign will become more public. So we're hoping to get the whole community involved in this. We know the emergency center touches a lot of lives. We think this is a very worthwhile project. So we hope to do very well on the capital campaign.
Our group's been here 24 years, and when we designed the current department, that was by industry standards, and we thought we'll never need another department. And then we outgrew that, and we added on a 5-bed pod to the north, and then we outgrew that, and then we added on a 9-bed pod to the south, and we outgrew that. Not only has our volume continued to increase every year, but the amount of equipment that we have, and as we've computerized, we've lost room in our individual patient rooms because we've got all this computers and technology that we didn't have to think about 20 years ago. So the fact that we're going to almost double our typical patient exam room is very welcome.
And will you be able to keep the ER open during construction?
I think we're going to be able to keep the ER open. That's there. There are people who are specifically planned for that, the transition planning, and it really helps a lot that We're not remodeling within our department. We're building a whole new shell, a whole new department. It'll be kind of a turnkey operation. One day we'll just move in.
A nursing home or your own home? It's good to be home, so call Ember Complete Care for all your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home, for skilled nursing, physical therapy, wound care, and more. Locally owned and operated, Ember Complete Care has been servicing all of Tuscarawas and Coshocton County since 1986, with a yearly average of $75,000 donated back into the community. Call 1-800-462-0909. Ember Complete Care. It's good to be home.
Are you suffering from asthma or emphysema? Do you have shortness of breath or a nagging cough you just can't shake? Hi, this is Dr. Nathan Samsa. I'm originally from Strasburg and I've returned after my medical training to serve the Tuscarawas Valley. I'm board certified in pulmonary medicine and I'm ready to treat your breathing and lung problems. My office is located at Union Internal Medicine Specialties, 515 Union Avenue, Suite 187 in Dover, Ohio. Call me at 330-343-4411 for a timely consultation.
Welcome to Medical Minutes here on Time Warner Cable DMG TV2. This segment we have Tuscarawas County Health Commissioner Dr. Jim Hubert, and we are going to talk about measles because there has been an outbreak in our region of the state. Explain how that all started.
Essentially, the measles version or strain that we're dealing with is rubeola, which is the 9-day measles. Rubella is not the case, but when we speak about immunization, we cover measles, 2 strains, and mumps. So what happened was that there were a group of volunteer or mission efforts with the Amish community who went to the Philippines to assist with a church-driven mission, and they had not been immunized, and they were exposed to individuals who were either active or who had been exposed to measles as well, and when they returned to the United States, they began to exhibit symptoms and then were found to be positive for rubeola, which is 9-day measles.
And it's spreading. We have dozens of cases now.
We have in our area, which would include Knox, Holmes, Ashland, Coshocton counties, over 150 cases. Most prevalent in Knox County, second Ashland, and close by is Holmes. And because we have had very significant relationships with our Amish community and their gatherings here for work, and also our Hispanic populations working in Holmes County, we can name any type of place for why people, say from Cuyahoga County or Mahoning County or Summit County or wherever, travel to our version of Amish country and theoretically could be exposed. So our goals have been to immunize those at the highest risk, which would be Amish who are not immunized, children and adults as well of our Hispanic population, and also individuals who would be at risk here, and those who really don't have their records any longer as to when I was growing up, I had chickenpox. I had a version of the measles. I may have had one vaccine, but the bottom line is that many people have not, and they don't have their records any longer. So there is no harm in receiving a booster to build your immunity.
And the Tuscarawas County Health Department has been giving them away for free.
Yes, they are free, and we have been extremely active. What has been a significant responsibility is to keep up with, in theory, those at risk who will appear. And we have performed assistance measures. The nursing staff and myself have attended the immunization clinics in Charm. We have also assisted with a community and as well a industrial clinic in Winesburg. And we have performed industrial but community immunizations at Superb Industries in Sugar Creek. We have held our specific evening immunization clinics at our health department on Iron Avenue in Dover, and we have also been accepting walk-ins for anyone, and they are absolutely free.
And how many people are taking advantage of the free measles vaccine?
Well, I think it's significant. We have, I was at the State Health Commissioners meeting last week. I know that the Holmes County Health Department had done over 3,000, and they obviously have a significant concern as to their percentage of population of immunized, non-immunized due to their demographics. Ours is a little bit less, but there is a significant number of our working people that are going back and forth. Now, if we say exposure and employees, we have given out or administered more than 600. We could do a lot more. The state is requiring, though, that we provide indication what the specific volume we expect to use on a basis. So a good example, when we were at Superb helping with East Holmes, Western Tusk, we performed 235 roughly that afternoon, and we performed nearly 140 at the health department one evening. So we're up in the vicinity of 600, but I believe that there are many others.
There's that many people that are not immunized?
Oh, there are many, many more. There are many, many more, and there is a test we can do to determine immunity, which would be a blood test. But the best way to test actually is called a PCR study, which is similar to what we do for whooping cough, and that is a syringe swab of the nasal area, and we send it down to Columbus, and it's absolute whether it is, yes, it is measles, no, it is not, and it's a very good study.
And do we have anyone in Tuscarawas County that now has the measles?
We have had 3 suspect cases. Now that is not a significant number. 3 have been in theory, 2 have been refuted by test, and 1 remains pending. But we believe that the pending case is an individual who's a young person who is improving. So.
And what are some of the symptoms of measles if they don't know what it is?
Measles are simply like a flu or a cold, where you have achiness, a temperature, possibly a runny nose, sore throat. General same findings we find with flu and with what we call cold or some sort of upper respiratory type manifest. However, approximately 4 to 7, 10 days into it, depending on the individual, they begin to show an entire rash over the body, and that becomes indicative of measles. So,
and it's different from chickenpox.
It is much different from chickenpox. Chickenpox involves the presence of vesicles, which are, and remember, chickenpox is a herpes virus and will develop blisters, and they're painful, or they're
But
more
measles is
uncomfortable.
just more of a general rash.
It's a rash with uncomfortable, with a fever and achiness, and commonly you treat them with normal anti-inflammatory or analgesics, which would be to bring a temperature down for the age group, and that's really it.
Is it fatal?
Measles pneumonia can definitely be fatal. You asked the question about chickenpox. I have not seen at any point in time that chickenpox pneumonia, that anyone has ever survived that. So when we're speaking of measles, people who develop pneumonia, which is rare, who have measles, do as well pass away. And so it's a very profound thing. And so another topic is we're looking at the new MERS-CoV virus, which has come to the United States from the Middle East, and it is presenting similar in the Middle East to SARS in 2003, which was in Toronto in Canada. And the presence of that has, depending on the population, a 40 to 60% mortality rate if they develop pneumonia. So, and so what I'm saying is chickenpox or measles pneumonia is a bad thing, and that's why we're trying to prevent that.
And another childhood disease that we get immunized for before we go to school is the mumps.
That's right.
That outbreak is in central Ohio. Do we have any mumps cases here in Tuscarawas County? We
have had 1 suspect mumps case which has not been confirmed. We have a lot of students that go to Ohio State, Capital, Otterbein, et cetera. Principally, the majority were on Ohio State's campus or in Franklin County per se. However, the number which we have here at this point is 0, but the suspect cases throughout the state are those who have been in Franklin County, been exposed as well by history, and then are placing anyone who they're in contact with at risk. So you have to pay attention to the possible exposure period of time, and which could be anywhere from 7 to 14 days roughly. I mean, there are varied statements as to the duration, up to 21 days for all these viruses. But if it's been 3 weeks or greater, commonly the risk is virtually fallen off and is unremarkable. So.
And it just seems, measles and mumps, and I thought you had to be immunized before you were allowed to go to school. So people they avoid being immunized for what reason?
There are only 2 medical reasons for not being immunized. The first being that you have an allergy to egg products. The second would be that you have a history of seizures. Now, many children at a very young age have had febrile seizures, where they have a high temperature due to a virus, and they have developed seizure activity. Commonly, pediatricians see that as a one-and-done effect, but it's one which is warranted and possibly should be administered with caution at that point. But the consideration is principally that there are no, other than if you have an egg allergy or you have a history of seizures. So
religious beliefs say I don't want to be immunized, or
the
fear of developing something else like autism. Those are other reasons I can think of.
Yeah, the one is a religious belief. However, if we would speak specifically of the Amish population, they have records, the adults including, of receiving their baby shots. And what you see is those are for tetanus, diphtheria, pertussis, things like that. And that they may have, if they're adults, missed on the measles, mumps, rubella type immunizations. The Hispanic population, if they are new adults here in the country, likely have not been, but if their children were born here, they are generally on time. And if they've not, they've been very good about coming in. And other groups would be those who homeschool due to a belief that there may be a danger, but the 2 principal dangers or risks are, again, egg allergy and history of seizures.
But everyone else should get their immunization.
Yes, they should. And what you just brought up, the autism topic, again, is a topic which was developed by a surgeon who was in training from the United Kingdom here, and he was studying Crohn's disease as part of a project. And there was truly no relationship between them. And so it has really affected the thoughts and mindset of many people when it comes to general immunization to protect their children. And I mean, so many people have come in because they are expectant mothers and they don't want to lose their baby, or they don't want unhealthy situations to occur with the development of their child, that it's fairly remarkable. And I commend the Amish and Hispanic populations for realizing that this is important to not only their health, but to the health of their children. One thing, we will be out in Superb Industries in Sugar Creek on June 9th from 1 to 5 p.m. because it is in the best interest in improvement of the immunity or protection against these viruses to have a booster. And so those who have received their first several weeks ago, we will provide a clinic on June 9th. As well, we have daily walk-in clinics from 9 to 11 and also 1 to 3 p.m. at the Tuscarawas County General Health District. And it is free, and we encourage everyone to consider either checking the records or considering protecting our population for the future.
Very good. Again, Dr. Jim Hubert, he is the Tuscarawas County Health Commissioner, here on Medical Minutes for Time Warner Cable DMG TV2.
Myers & Miller Podiatry provides complete foot and ankle care to patients of all ages. The practice was established in 2000 by Dr. Adam Myers and has grown to include Dr. Andy Miller in 2007 and most recently Dr. Jason Backage in 2010. Our core values of respect and honesty are the basis for how we manage our practice, and we have grown by building relationships with our patients in order to better serve their needs. Myers and Miller Podiatry serves Tuscarawas and Holmes County with offices in Dover, Sugar Creek, New Comerstown, and Millersburg. Let's get started building our relationship.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome to Medical Minutes here on Time Warner Cable DMG TV2. This segment, we are at the American Red Cross offices in New Philadelphia, and we're talking with Heather Gribble. She is an instructor trainer for CPR. Heather, welcome to Medical Minutes. And tell us a little bit about yourself. How did you get involved in training?
Actually, I started about 8 years ago. I came in as a volunteer, just kind of helping do paperwork around here. And Debbie, who was our associate director at the time, was like, hey, do you want to teach classes? And I was like, I don't know, that's talking in front of people. And I became an trainer, and it just kind of went from there. So, and I love it. I love doing the job.
So tell us, what is CPR? What does that stand for?
Cardiopulmonary resuscitation. Basically what you're doing is you are compressing the heart and pushing oxygenated blood throughout the body when the heart isn't functioning properly on its own.
You don't have to be a doctor to do that?
No, anyone can do it. Actually, that's what this program was designed for, people who are non-medical personnel and need to get this type of training, because you never know when a loved one is going to suffer some type of medical or cardiac emergency. So it's always best to be prepared.
And what is involved when you do CPR? It sounds complicated.
No, it's actually very complicated, or very simple. Sorry, it's not complicated at all. When you really break down CPR itself, there's really only 3 ways that lay responder can go. You do have different things that you can be doing with a conscious person, and there's first aid as well. But CPR itself is what seems to be the most daunting of all of it. And really, you're only asking yourself 2 questions. Is the person breathing, and is the airway open or closed? If they're breathing, the airway has to be open. Kind of just makes sense, right? If they're breathing, then you're just going to monitor the situation, deal with any bleeding, anything like that you need to deal with. If they're not breathing, the airway is open, you're going to do, it's the regular CPR that most people really know about. If the airway is closed or blocked, you're going to do a modified CPR for an unconscious choking victim, which is just like 2 minor steps more than the regular CPR. So,
well, let's start with regular CPR. They're not breathing, but there's nothing blocking their airway. What should you do?
First step is actually, after you have checked your scene, make sure the scene is safe. The first thing that most people do not think about is make sure the scene is safe for yourself. You don't want to become a victim yourself. Don't be going into a burning building or, running out into the middle of a 4-lane highway or something like that. But once you've made sure that the scene is safe, you've checked to see if the person is responsive, that they're not.
And this is Dean, our CPR.
This is Dean, our CPR mannequin for today. Once you have realized that this person is not conscious, okay, you do want to call 911 because you can't do CPR forever, okay? You definitely want to get that call in for medical personnel to come and take over at some point because you don't want to do this for a long amount of time if you can avoid it. You want to tilt that head back and listen for about 10 seconds for signs of life. You really want to get your face down there, listening for breathing, feeling for it on your cheek, and watching for the chest to rise and fall. And the reason that you tilt the head back is because the tongue can actually fall in the back of the throat and block the airway for you. A lot of people don't think about that. Have you ever fallen asleep in a chair and your chin kind of comes down and you catch yourself snoring? That's one of the reasons why. So, but then at night, sometimes when you're not feeling well, like maybe you have a sinus infection, you catch yourself kind of doing this. That's one of the reasons why, because it just opens up your airway more. So you tilt that head back. If you realize they're not breathing, and lay responder CPR for an adult, we go straight to CPR. So you find your hand placement, which is in the upper part of the chest. This is not the chest. A lot of people don't realize. This is the abdomen, okay? So in the center of the chest, you place your heel of your hand in the center of the chest, fingers locked, and your fingertips up. You don't want to drop your fingertips, that's for sure. And it's very difficult to do this on the table because, well, I'm really short. But the proper placement, and you can kind of see my elbows are locked, like you don't have a joint here, okay? So that you would be dropping your body down on top of this mannequin as a body weight instead of trying to push with your arms. That's going to wear you out really quickly. But what you're going to do then is you're actually going to compress the chest about 2 inches. Actually, for an adult, it's at least 2 inches, okay?
So Dean here, I'm listening to some of the air come out. Should you hear that when you are pushing on a patient's chest?
You may or may not. The mannequins are actually made to do that because otherwise they wouldn't work correctly. You may hear air coming in and out of the victim. That does not particularly mean that it's going in and out of the lungs. That's one of the myths that a lot of people have really kind of come to me with. I've had a lot of people come to me over the last several years and say, well, we don't do breaths anymore with the compressions, do we? Yes, we do.
That's when you pinch their nose and breathe into their lungs to try and get some of that air moving again, right?
That's correct. Those are called rescue breaths, okay? There's a difference between rescue breathing, which in our upper level courses is called ventilations, where you would breathe for a victim for an amount of time if there's no breathing, but there is a pulse, okay? That's a completely different level. A rescue breath is what you would do, like you said, if you tilt the head back, pinch the nose, and you're breathing into the victim, okay?
And then you start the chest compression.
You're doing chest compressions, at least 2 inches on an adult, about 2 inches for a child, about 1.5 inches for an infant.
Okay, how is a layperson measuring that? 1.5, 2 inches, it sounds about the same to me.
It's a little bit difficult. You know, you just kind of get a feel for it. You definitely want to make sure that you're getting enough depth, because if you don't, then you're not actually compressing the heart to push that blood out. And that's very important. That's kind of the idea behind, well, that really is the idea behind that. What you're doing is actually compressing the heart to push all of that blood out. And when you release the compression, the heart will pop back open and it fills with blood again. So it's primed for the next compression. It's a big pump. But it needs oxygen too. So that's one of the things that a lot of people don't understand. It's not just compressing the chest that's so important. You have to make sure that that airway is clear. So that is why we still do the breaths.
All right, so we've got a breath in there. We start. How long should you continue? How many compressions do you do at once?
You do 30 compressions in about 18 seconds. So that rhythm is really kind of fast. You don't want to go too slow because then you're not getting enough compressions to get the blood moving. But you also don't want to go too fast. There is a...
Oh, great. Go quickly, but not too quickly.
Right. Your timing is basically like 1 and 2 and 3 and 4 and 5 and 6. You're doing that and in between until you hit the number 21. And then you throw out the and because the actual number, you get that extra rhythm in there. But it's 30 compressions in 18 seconds followed by 2 breaths. And that's like a puzzle piece. And you're just stacking those puzzle pieces right on top of each other. CPR is continued until either another trained responder or the EMS arrive. The AED arrives on scene. You're too exhausted to continue. The scene becomes unsafe, or the victim starts breathing again on their own. If they start breathing again on their own, it's going to be extremely obvious.
I was going to say, how are we be able to stop?
Yeah, they might even tell you to stop. No. But it's going to be an obvious breath. It's going to be something that's going to catch your attention even as you're cranking away doing compression. So we used to, at one point, after, say, 5 cycles of 30 compressions and 2 breaths, stop and recheck for signs of life. For regular CPR, we don't do that anymore. You just keep going. Another thing that we would not particularly stop for, but we would change what we're doing. If at any point those breaths do not go in, you retilt the head, because that's why I kind of explained earlier that the tongue can relax in the back of the throat. You would readjust the head, maybe tilt it back further for an adult, or for a really small child, you would maybe tilt it down a little bit further, maybe closer to their chest, because infants and small children, their airways are so small, it's like pulling on the neck of a balloon. I mean, we've all done that. Blow up the balloon and make your kids laugh with pulling on the neck of it, makes that funny noise. But that can actually block the airway as well. So readjust the head, give 2 breaths again. And then if that still does not make the breaths go in, then you need to switch to that modified CPR for the unconscious choking victim.
Well, it sounds like we need to take a CPR class. And, who should take this? Everyone should be certified in CPR. You've had an instance where you were at a restaurant and needed to use it.
Yes, actually, I was out of town, and this gentleman started choking, and he stands up, and a friend of mine, she knows what I do, obviously, but she's a little leery on using this, and she stood up and she yells, "Fix it!" Just because that's just the way that she is. And I ended up doing back blows and abdominal thrusts, which is how we actually deal with conscious choking now. But what a lot of people don't understand is these pieces fit together. And if, when you have that great instructor that's able to put all these pieces together, at the end of class, everything is going to seem more simple. It's really hard to put it together and show it to you in just a small segment. But take the class, and it really makes a lot of sense. I've had a lot of my students come back to me in a year or now 2. Our certification is a 2-year certification, and they remember it. They're able to pull it back right away. They remember everything. So it's nice.
And how do you sign up for the classes at the American Red Cross?
You can either call 1-800-RED-CROSS. There are different options. Once you get to their menu, you can actually speak to a person on the phone that way and sign up through there. Or you can go to redcross.org and sign up online. They have classes here. They have classes in Stark County, just different areas. So
all good advice to make sure that we can help someone if they need CPR.
And you never know who it is. When I teach, I tell everyone to think that, even if it's somebody who is older, a lot of people, that's one of the things a lot of people have a problem with is, I'll save a young child. They have no problem saving that young child, but an older person, for some reason, a lot of people have a real issue with that. But that's somebody's grandmother, that's somebody's mother, that's, you have to think of it that way. And, I know a lot of grandparents who are raising somebody else's children. That may be the only person that a child has. So you never know who that person is to somebody else. That is somebody's grandmother, that is somebody's grandfather, somebody's husband, somebody's wife, somebody's kid. I would want somebody to help me, and somebody help my kids. It's the way I just look at everybody.
All right, very good. Our CPR instructor trainer for the American Red Cross here in the New Philadelphia offices, joining us here on Medical Minutes. Thanks for being with us.
Thanks for having me.